is actually a pretty common sexually transmitted infection, or STI. It can cause sores or blisters around the genitals, the bottom, also known as the anus, or even the upper thighs. However, many people with genital herpes have no symptoms at all, or just very mild symptoms that might go unnoticed. And even if there are no visible sores, the virus can still be present and passed on to sexual partners. While genital herpes can definitely be uncomfortable at times, it's really important to remember that it's a manageable condition. With the right care and treatment, people with genital herpes can live normal, healthy lives. Genital herpes is caused by the herpes simplex virus, or HSV. There are actually two types of HSV. HSV-1 usually causes oral herpes, which you might know as cold sores or fever blisters around the mouth. But HSV-1 can also be spread to the genitals through oral sex. Then there's HSV-2, which is usually spread through sexual contact and is the most common cause of genital herpes. HSV is highly contagious and can be passed on even when someone doesn't have any symptoms. The virus spreads through direct skin-to-skin contact with an infected person, usually during sexual activity. This includes vaginal, anal, and oral sex. Once HSV gets inside the body, it infects skin cells and starts to replicate. The virus then travels to nerve cells near the spinal cord, where it can sort of just lie dormant or inactive for long periods. When the virus reactivates, it travels back down the nerve to the skin, causing another outbreak of sores. Many people with genital herpes actually have no symptoms, or the symptoms are so mild they just go unnoticed. When symptoms do show up, they usually appear within a few weeks of infection. This first appearance is called the first episode or primary infection. Symptoms of a primary infection can include media group, close-up of small painful blisters on genital area, medical context, clinical photo of herpes, blisters on skin at its stalk at it distribute _equally, small painful blisters around the genitals, anus, or thighs, flu-like symptoms like fever, headache, and muscle aches, painful urination, vaginal discharge, swollen glands in the groin. After the first episode, the virus goes dormant in the nerve cells. It can reactivate later, causing what's called recurrent outbreaks. These outbreaks are usually milder than the first episode and may just cause a few sores. Some people experience frequent outbreaks, while others have very few or none at all. It's important to note that not everyone with genital herpes experiences these symptoms. Some people may only have very mild symptoms or none at all. That's why it's so important to get tested for STIs regularly, especially if you're sexually active. If you're experiencing symptoms of genital herpes, it's really essential to see a doctor or another healthcare professional for diagnosis and treatment. They'll ask you about your symptoms and sexual history, and may take a swab of the sores for testing. This helps confirm whether the herpes virus is present. Now, there's no cure for genital herpes, but there are antiviral medications that can help manage the symptoms and reduce how often and how severe outbreaks are. These medications work by stopping the virus from replicating. Some commonly prescribed antiviral medications for genital herpes include acyclovir, also known as Zovirax, valacyclovir, which is Valtrex, and famciclovir, or Famvir. Treatment might involve taking antiviral medication every day to suppress the virus, which is called suppressive therapy, or only during outbreaks, which is episodic therapy. Your doctor will recommend the best treatment option for you. In addition to medication, there are some things you can do to manage your symptoms and help prevent spreading the virus. Keep the affected area clean and dry, avoid touching the sores, wash your hands thoroughly after touching the area, avoid sexual contact during outbreaks and until the sores have completely healed. Use condoms consistently when you're not having an outbreak, and let your sexual partners know about your diagnosis so they can get tested and treated if necessary. If you're pregnant and have genital herpes, it's really important to tell your doctor. There's a risk of transmitting the virus to your baby during childbirth. Your doctor can talk with you about ways to minimize this risk, like taking antiviral medication during pregnancy and possibly recommending a cesarean section delivery. Remember, genital herpes is a manageable condition. With proper care and treatment, you can live a normal, healthy life. And if you have any concerns or questions, please don't hesitate to speak with your doctor or another healthcare professional.